Thanks for joining us tonight. Stay with us. First, the nurses who say government failures to provide personal protective equipment, or PPE, is putting their lives at risk. One nurse from Merseyside tells us he and his colleagues are worried at recent advice that it can be washed and reused. He feels nurses are being abandoned. At the same time, some companies in the Northwest are desperate to help. They've adapted themselves to make it, but they say government red tape is holding them back. The nurse who starts our report didn't want to be identified. He's been speaking to our political correspondent, Hannah Miller.
It's just a really scary situation to be in. It feels like we've been abandoned, and the government that's supposed to be protecting us is letting us down. They know that no nurse would ever leave their patient, and it feels like every decision that's been made in regard to PPE has been based off that fact.
They're the people meant to protect us and stop the coronavirus pandemic getting worse. But now some nurses say they're not getting the protection they deserve after the government asked them to reuse items of personal protective equipment in times of extreme shortage.
What was your sort of first thought when you saw the new guidance?
My heart literally sank. It literally sank because I feel stuck, and it's just putting us at risk. Everyone keeps calling us heroes, which is fine and everything, but like, when I become a nurse, I never actually imagined that I'd be putting myself at risk.
And already in the Northwest, more than 6 healthcare workers have lost their lives. Now unions say it's hard to know whether the latest advice is putting more lives at risk.
What the response is to is simply a lack of PPE. This isn't the solution, it's a make, do and mend, and it just won't do.
Are you convinced that all nurses who are going to work today are going to be able to operate safely in terms of their own personal protection?
From the responses we've had, I'd find it incredibly hard to give that assurance. The nurses are now being placed in a position where they have to consider whether they can actually continue to treat patients in those circumstances.
At this factory in Macclesfield, they're offering to help, making face shields where they once made masking tape. But at the moment, none of this equipment is making it to the front line.
We're told that they've cut various red tape to help people get product into the marketplace, but from our experience so far, either that message isn't getting through to the NHS themselves, or it's just being ignored.
The Ellesmere Port MP says companies like this could be the solution.
Well, clearly it's all got to be safe in the first place. It's got to meet the right standards. But what we're finding at the moment is that conversation isn't even taking place. What we really need is a way of that all being coordinated and joined up so that actually we can get the right equipment out to the right people as soon as possible.
And as he carries on working while he waits, the nurse we spoke to had this message.
Everyone praises everyone in the hospitals for saving lives, but actually, if you stay at home, you'll probably save more lives than what I'm going to save in the next couple of months, which is weird, and you won't see it, and you won't know who you've saved, but you will have saved lives by staying home.
Well, Hannah, as we heard, there's so many businesses in the Northwest want to help and meet this demand, but it's not as simple as them just handing it over to the NHS, is it?
Unfortunately not. There is a whole procurement process to go to. The government does acknowledge that there are issues in getting enough personal protection to the front line. A Downing Street spokesperson told us earlier today that they're working to progress orders from as many as 6,000 different companies across the UK who have made offers of various different items, and they say they will pursue every possible option. That change, though, to the government's advice around reusing personal protective equipment has dominated the press conference that we've seen in the last hour or so. The government very keen to stress that it is what they call advice, not guidance, and they say it's designed to make people safer, to allow them to reuse something where there really would be absolutely nothing else available. They describe getting enough personal protective equipment as an international challenge, and they're trying to reassure those people working on the front line that they will get personal protective equipment to them as soon as possible.
Hannah, thanks very much for that.